Welcome to another edition of MIA Minutes. I'm your host, Joe Spiatko, Communications Director here at the MIA. Joining us is Patti Dorn, Health Insurance Administrator for the Maryland Insurance Administration, to continue the discussion in our three-part series on navigating your health insurance claims. Today, we'll go over exactly what types of plans the MIA regulates or has jurisdiction over. Jurisdiction. That sounds like a legal term. Patti, care to explain?
Yes, I sure can. Jurisdiction means that the MIA has the authority to regulate entities and individuals. Those entities and individuals that must comply with our regulations are those who fall under our jurisdiction. If they fall under our jurisdiction, in most cases, we issue them licenses, we review their premiums and the policies they issue, and we review financial statements, conduct examinations, and we issue orders and penalties for violations of Maryland's insurance laws. And very important, if we have jurisdiction over your insurance policy, we can investigate complaints that you have against the insurer or against the person who sold you the insurance policy.
So, if it's an insurance company or an insurance agent or broker, we have jurisdiction to regulate them?
So many of them, but not all of them, and that's what I hope to clear up today for you.
Okay, so who exactly do we have jurisdiction over?
So the MIA has jurisdiction over most insurers and insurance producers. Insurance producers are the agents and brokers you mentioned, as well as others such as premium finance companies, motor clubs, and HMOs authorized or licensed to conduct business in Maryland.
Okay, so when it comes to health insurance plans, which ones fall under our jurisdiction?
All right, so things get a little complicated when it comes to our jurisdiction over health insurance and health plans. And so I want to break this down and make it as easy as possible to understand. But just for a second, I want to take a few seconds and say that while this conversation is about the health insurance policies we do not have authority over, that doesn't mean you cannot reach out to the Maryland Insurance Administration if you have a policy that we don't regulate. You can reach out to us and we will help you get to the entity that will help you, whether or not we have jurisdiction over your health plan. But let's back up and let's start with who we have jurisdiction over. The MIA generally has jurisdiction over contracts, policies that are issued or delivered in Maryland. So if you purchased an individual policy or a family policy from an agent, a broker, or a health insurer directly, we likely have jurisdiction over your policy. If you purchased your policy from the Maryland Health Connection, we definitely have jurisdiction over your policy.
Okay, so in these cases where we do have jurisdiction, you can come to us if you are having an issue with your health insurance policy. In other words, file a complaint?
Exactly. So earlier in this podcast series, you talked about the appeals and grievance process. If you have one of the policies we regulate and your insurance company has made an adverse medical decision that you disagree with, you can file a complaint with us and we will investigate. In addition, if you have a complaint against your insurer regarding a contract issue, so let's say that you believe you're entitled to 10 physical therapy appointments and your insurer says that you're only going to get 7, you can file those complaints about contract issues with us as well.
Okay, which other health insurance policies do we have jurisdiction over?
So in many cases, if you get your insurance through your job, we may have jurisdiction over that policy, or we may not. It depends on whether or not your plan through work is self-funded. So insurance through your employer can be purchased through an insurance company, or it can be self-funded by your employer.
So what does it mean if you are in a self-funded plan?
It means that the pool of money that's being used to pay your claims does not belong to an insurance company. It actually belongs to your employer. They are self-funding your insurance. The employer pays the insurance claims. In almost all of these cases, if you have a self-funded plan, you still carry a health insurance card with a health insurance company's name on it. That company is only providing the administrative services for your employer. They are not providing that pool of money that is used to pay claims.
Okay, so in these situations, your health insurance isn't actually being provided by a health insurance company because that pool of money belongs to your employer?
Yes, exactly. If your employer purchased your policy through an agent, broker, or an insurance company directly, or the Maryland Health Connection, then we likely do have jurisdiction over them. But we do not have jurisdiction over employer self-funded plans. That does get confusing for consumers because they may not know which one they have. If you don't know, you can confirm with your company's HR department, or you can look at your insurance ID card. So the cards will have the letters MIA printed on it if the MIA has jurisdiction over your health insurance. If you work for a large employer, you're likely in a self-funded plan, but not always. Smaller employers are much more likely to be providing you with health insurance that they have actually purchased from a health insurer.
Okay, so let's say you do work for a company that self-funds their insurance plan. Where can these folks go to file a complaint?
All right, good question. So you'll start the process with the health insurance administrator, or you can reach out to your HR department. If you need to elevate your complaint, the U.S. Department of Labor's Employee Benefits Security Administration, they're the ones that regulate self-funded plans, and they have the authority to investigate and they have the authority to resolve the complaints against such plans.
Okay, what about government employees? People like us who work for the Maryland state government, or maybe local or federal employees.
All right, so those plans are usually self-funded. As Maryland state government workers, we would reach out to Maryland Budget and Management, the Health Plans Benefits Group, with our complaints. Federal employees who are receiving their insurance through the Federal Employee Health Benefit Program, they're going to need to contact the U.S. Office of Personnel Management to file a dispute after they have exhausted their insurance carrier's own internal appeal procedures. And those are found in their plan brochure.
Okay, what else?
So, all right, so next. Maryland law generally does not apply to insurance contracts or policies issued in other states. So policies issued in other states. For example, let's say you live in Maryland, but you work in Virginia for a Virginia employer. If your health insurance policy was issued in Virginia, then Virginia law applies to your coverage. And the MIA has very limited jurisdiction in that situation. In these cases, you're going to need to contact the regulator in that state for assistance.
Wow, jurisdiction gets a little more complicated with your health insurance, doesn't it?
Yeah, it does. The MIA also does not have jurisdiction over federal programs, such as the Federal Employee Health Benefit Program, which I mentioned earlier, as well as Medicare, Social Security. But I do want to expand a little bit on our Medicare jurisdiction. We do not have any jurisdiction over Medicare Part A or Medicare Part B. We have very limited jurisdiction over Medicare Advantage and Medicare Part D plans. We regulate them only for solvency, company licensing, and producer conduct. So we have full jurisdiction over the Medicare supplement plans.
Okay, so to clear that up, a consumer can come to the Maryland Insurance Administration to file a complaint about their Medicare supplement policy, but not for any other parts of Medicare?
So almost. They could come to us if they wanted to file a complaint against an insurance agent or broker who sold them a Medicare product. So we regulate Medicare products sold in Maryland for producer conduct. But if they have a complaint about Medicare Part A or B, Medicare Advantage plan, or a Medicare Part D plan, the consumer needs to file those complaints with the U.S. Centers for Medicare and Medicaid Services. You can file a complaint with CMS about your healthcare provider, the hospital, your health or drug plan. You can file a complaint about the quality of your care, or an issue that you might have with durable medical equipment. You file an appeal, not a complaint with Medicare, if you're unhappy with Medicare, with a Medicare plan's refusal to cover a service, a supply, or a prescription drug.
So how do Medicare beneficiaries file complaints or appeals?
Well, you can always get started by calling 1-800-Medicare. But if you're tech savvy, you can do a search engine search of how to file a Medicare complaint. That should take you right to Medicare.gov, but you really need to make sure that you are actually on Medicare.gov. That information is also on the Medicare summary notice that Medicare beneficiaries receive every 3 months.
Okay, so since Medicare beneficiaries are often part of our most vulnerable population, what if someone on Medicare is overwhelmed by the process? Where can they go for help?
That's important. So Maryland Medicare beneficiaries can contact the State Health Insurance Assistance Program, which is known as SHIP.
SHIP? What is SHIP?
Right, so SHIP is a program that helps those on Medicare with personalized Medicare counseling, education, and access to financial assistance resources. SHIP offices help Medicare beneficiaries identify and understand programs and plans, such as Medicare prescription drug coverage, Part D, Medicare Advantage plans, and the Medicare supplement insurance policies. And they can help you with the complaint, they can help you with the appeals process. The services you receive through SHIP offices are confidential and free.
Okay, so how does one contact SHIP?
So in order to contact SHIP, to get the contact information, you can look at the Maryland Insurance Administration's website. We have that information. As well, you can also look at the Maryland Department of Aging's website for that information, or you can reach out, you can call the Department of Aging, and they can give you the number to your local SHIP office.
And what about Medicaid?
So Medicaid. Medicaid also, in most cases, does not fall under our jurisdiction. Medicaid in Maryland is called Maryland's Medical Assistance Program. It's a joint federal and state program. MIA has very limited jurisdiction over this program and can accept complaints from providers only regarding prompt payment of claims. If a beneficiary of Maryland's Medical Assistance Program, if they have the letters MDH written on their ID card, they can file their complaints with the Maryland Department of Health.
Thanks, Patti, for joining us today. I really appreciate you spending some time with us to cover what the MIA's jurisdiction is, giving us some legal definitions and some great information for our consumers.
Thanks, Joe. I hope it was helpful, and thanks so much for having me on today.
It's been great.